My name is Dr. Craig Hudak. I'm one of the interventional cardiologists here at Carolina Cardiology. In addition, I'm the director of the Chest Pain Center, the Coronary Care Unit, and Cardiac Telemetry at Greenville Memorial Hospital, which is part of the Greenville Hospital System. An atrial septal defect is, in simple terms, a hole in the heart. It's a congenital heart defect. In other words, it's something that you have when you're born. The heart has 4 chambers. The upper chambers are the atria. The wall between the atria is called the septum. A defect in that wall is an atrial septal defect. You may not know initially that this is what you have. If the hole is large enough, it's discovered during infancy because there are problems with nursing and feeding and shortness of breath. There's a certain percentage of the population that doesn't find out about this until later. Usually that's because people are having some exercise intolerance or some shortness of breath or perhaps some swelling in the feet. Many of the times people come in with a variety of symptoms and get what's called an echocardiogram, which is simply an ultrasound of the heart. And the atrial septal defect, or ASD, is detected at that time. If that defect is large enough that there's been too much blood flow to the right side of the heart, then that requires closure. About 85% of the time, because there are different types of atrial septal defects, there's different locations in that wall between the upper chambers of the heart. But about 85% of the time it's in the center of the septum and can be closed in the cath lab with a very simple technique. After the atrial septal defect closure procedure that's done in the cath lab, people are ambulating the same day and are generally out of the hospital the very next day, which is a lot different from the former treatment for that, which involved open heart surgery, in which people were usually in the hospital for 3 to 7 days. A PFO is what's called a patent foramen ovale, which is Latin terminology for the anatomy, again, in the same area of the septum, the wall between the 2 upper chambers of the heart, but it's not a hole. It's the failure of the 2 layers of that wall to fuse after birth. That generally is not a problem, and in fact is seen in many normal individuals, but there are situations where a blood clot can transition through that communication, causing a stroke or other problem. And in that situation, again, the treatment is somewhat controversial in terms of whether we should use medicines or close that, but closure is definitely one of the techniques that's been used across the nation. It's been used with great success. We've used it to great success here at Greenville Memorial. In fact, Greenville Memorial, when I came here 10 years ago, was the first hospital in the upstate of South Carolina to perform these type of procedures. In terms of the closure of atrial septal defects or patent foramen ovale, Greenville Memorial Hospital is definitely the best place in the upstate to come because we've had 10 years of experience doing this, and we have an excellent track record. We've been using intracardiac echo for guidance during that time, which allows a much less invasive procedure as well. Greenville Memorial Hospital is really the only hospital in the upstate at this point in time that is frequently doing these procedures.